Hi everyone, I'm Dr. Larissa and I'm Channel Mum's women's health, pregnancy and fertility expert. And I'm coming to you during the coronavirus pandemic when an incredible number of people is going to be very anxious, very worried about what this means for themselves, their children, their families, and in particular if you're pregnant or looking to get pregnant. We've had floods of questions streaming in, both through myself and Channel Mum. And I really just wanted to take this time to try and address some of these and help provide some personal support for you in those areas where you're most worried.
So if your partner is working from home but has to go out to occasional meetings and picks it up, then what's the point in staying at home?
He is at risk of getting coronavirus, and if he's coming back home to you, then yes, that also potentially puts you at risk. But this is why the government has recently said that actually we should all be practicing self-distancing. So hopefully your husband is going to be able to discuss with his boss and his team about whether he can actually work from home and whether his travel can be reduced. And in most circumstances, given the current climate and the current pandemic situation, hopefully this is going to be possible.
Should I be going to scans and midwife appointments?
We've started running virtual clinics, so it may mean that your midwife or doctor contacts you by phone to see how you are, or if you're worried about anything, you contact your midwife or your local maternity or triage unit to discuss any symptoms with them. But the idea is that we limit the amount of time you spend in the hospital, coming into hospital. We limit the opportunities for you to essentially catch coronavirus, and we try and keep you at home wherever possible. So whilst it's really important you carry on having antenatal appointments, the way in which they're conducted may be different. So do check with your local maternity service about that. Pregnant women are being told to stay at home, but I can't do my job from home. So what am I supposed to do? It's important to definitely have that discussion with your employer, because most companies and most employers are now essentially encouraging all their staff to work from home because of the government guidance on self-distancing and self-isolation in some cases. So I would definitely speak with your department, with your manager, with your boss about this, and especially if you're pregnant, trying to limit any face-to-face contact and any opportunities for you to mix with people who may have coronavirus. So it's very important that your employer respects that and the government guidance on the 12-week rule, which is essentially to self-distance yourself and spend most of your time at home over the course of 12 weeks if you're pregnant.
If you have nobody to do your grocery shopping and you rely on public transport, what should you do?
What I would say is to see if you can get your shopping done online. Maybe a willing neighbour or someone that you know, a relative who's willing to go and do the shop for you and drop it off outside your door.
Are you meant to self-isolate once the baby arrives?
Not self-isolate as such, but certainly try and implement self-distancing and also limit the number of visitors in the house. So I would say that's definitely true once the baby arrives, because both you and your baby and your family will be at risk if you have lots of visitors come over, even if they're relatives. So I'm afraid it does still mean trying to spend the majority of your time in the house and limiting any opportunities where you might be able to get this infection. But the great thing about, I guess, this pandemic being in the social media era that we are in is that actually there are lots of opportunities to connect with other people. There's lots of social forums. Channel Mum have a great new sort of panic-free coronavirus section of the website where you can go and talk to others who are in the same situation as you, doing exercise, keeping moving, going outside into nature wherever you can, obviously maintaining distance between people and others as you do so, and trying to have some routine to your day where you're still doing some nice activities indoors, but you've got something to look forward to.
Can the virus be carried through my breast milk?
So as far as we can tell through all of the tests that have been done, the mothers who have been affected by coronavirus haven't transmitted it into breast milk. So there hasn't been a single case yet where breast milk has tested positive for coronavirus. So this is really reassuring, and essentially it means that if you want to, you will still be able to breastfeed your baby. But I would still recommend the same as the WHO does, that you still take the necessary precautions. So this is things like washing your hands before and after you touch your baby, making sure that any equipment that you use to perhaps help you breastfeed is cleaned properly and sterilized, that if anyone is helping you to breastfeed, that they also take the necessary precautions and clean appropriately. And if you have got a face mask, especially if you're coughing or sneezing or feel unwell, then you do wear this whilst you're breastfeeding to try and limit any droplets.
If your partner shows symptoms of COVID-19 and you're pregnant, what should you do?
It's really important that he goes into self-isolation, but away from you. So this is going to be quite difficult to manage at home, but ideally he needs to have a separate room that he keeps well ventilated, but where he spends the predominant amount of time in. So ideally he also needs to be eating at a different time to you and the family, using different cooking utensils to you, using different toiletries, different towels. So trying to limit the risk of any cross-contamination that could be going on. And I'm afraid this will need to be done for 14 days, and whereby you will also need to self-isolate for 14 days too, simply because we have no other way of trying to limit the coronavirus from spreading.
Since there was a baby born with COVID-19 in London, should we be worried about giving birth in hospital?
The newborn baby was tested 36 hours after they were born and found to be positive. And it's thought through the majority of the reassuring evidence we have so far that this wasn't as a result of transmission from the placenta to the baby, but in fact could have possibly been during delivery, because if a baby is delivered vaginally, the baby can pick up various different microbes from the mum. Or more likely that this actually happened as a result of the environment the baby was in afterwards, but we don't know the details yet. We will be screening, and every hospital will have its own measures in place, but rest assured that if anyone does demonstrate symptoms, then all the necessary precautions will be implemented in hospital for that person. So please don't be afraid to come into hospital, and actually if you have symptoms of coronavirus or you're worried that you might potentially have it, it's really important that you do deliver in hospital, because this is really the only way we're effectively going to be able to monitor your baby.
Can COVID-19 bring on preterm labour, and is this something I should be worried about?
It is true to say that out of the limited number of cases we've had so far where women have tested positive for coronavirus, a few of them have had preterm labours, but we're not sure yet whether it's the actual coronavirus that's caused the preterm labour or whether it's been something else that's meant that these women have needed to be delivered earlier.
Will our birth partners still be able to support us in labour?
Also, providing your birth partner is well in themselves and they're not suspected of having coronavirus, then yes, absolutely they can come. But I'm afraid that practically all maternity units are now limiting the number of people that can be present with you. And this is again to try and reduce the risk of coronavirus spreading to any other woman and healthcare worker there as well. I'm a nurse and pregnant. Should I be working? Actually, the Royal College of Obstetricians and Gynecologists has just recently this weekend released new guidance regarding this exact same question. What the current guidance is saying is that if you are well, you don't have any underlying health conditions, and you're under 28 weeks pregnant, then actually it is still okay for you to continue work, but taking the necessary precautions. So in hospital, this will be about trying to limit your exposure to anyone who has coronavirus or any patients who may be affected by it. And if you have to work around them, making sure that you have the necessary protective equipment to do so. But essentially trying to keep you away from those high risk areas where you're still able to do your job, but aren't so much at risk of that. If you are over 28 weeks and if you have any underlying health conditions, you don't work in your usual place, and that you limit your exposure to anyone who could have coronavirus at work. So this essentially means trying to work from home. Please remember the people who are keeping our societies going, and please try and stay at home if you're well enough to stay at home and deal with this yourself. Sending you lots of love.